The essential feature of a substance use disorder is a cluster of cognitive, behavioral, and physiological symptoms. The cluster indicates that the person keeps using the substance in greater quantities for a lesser desired effect for a longer period in time than originally intended. A person may have multiple unsuccessful efforts to stop use and may spend a great deal of time obtaining and recovering from the substance. Tolerance is defined as a remarkably increased dose to get the same desired effect. This is one of the criteria for having a diagnosis of substance use disorder. One of the other criteria, out of several others, is withdrawal. This is a syndrome that occurs when blood or tissue concentrations of a substance decline in a person who had maintained prolonged heavy use. Treatment of substance use disorders includes behavioral therapy, individual and group therapy, detox if needed, which is going usually to a medical center and having them oversee you withdrawing from the substance, and maybe administering medication to make sure you can do so safely. People can actually die from withdrawal of alcohol use. A part of treatment is an individual develops a relapse prevention plan. This identifies triggers, which are for the triggers that make them want to use a substance. They also address cravings in these programs. And if a person goes to a rehabilitation facility, then they typically go to an aftercare program once discharged. This is a less intensive program, and it doesn't even have to be inpatient. It can be outpatient. And they work on, again, the relapse prevention plans, triggers, and positive features they have in their life to make them more motivated to continue with the relapse prevention plan.